Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the December 2012 print journal. In our current issue, Mayo Clinic Proceedings expresses thanks. Thanks to the almost 400 individuals who reviewed submitted manuscripts for Mayo Clinic Proceedings in 2012. Without the reviewer support, identifying the highest quality material for Mayo Clinic Proceedings would be impossible. Thanks also to Dr. Scott Litton, who has been an associate editor of Mayo Clinic Proceedings for 19 years and will be stepping down by the end of 2012. You will find the name of all our reviewers and our Editor-in-Chief's expression of gratitude towards Dr. Litton in our December issue. This month's Editor's Choice is the original article entitled Association of Resident Fatigue and Distress with Occupational Blood and Body Fluid Exposures and Motor Vehicle Incidents by Dr. Colin West and colleagues from Mayo Clinic in Rochester, Minnesota. The authors conducted a prospective longitudinal cohort study of 340 internal medicine residents who self-reported blood and body fluid exposures and motor vehicle accidents in quarterly surveys. These incidents were correlated with validated measures of quality of life, burnout, depression, fatigue, and sleepiness. The authors found that exposures to blood and body fluids were rare, but motor vehicle incidents were common and higher levels of distress may be contributory factors. A video interview with Dr. West can be viewed on the homepage of Mayo Clinic Proceedings. The accompanying editorial entitled Physicians' Well-Being and Safety, It's Not All About Sleep, was authored by Dr. Paul Rocky from the Accreditation Council for Graduate Medical Education, or ACGME for short, in Chicago, Illinois. Dr. Rocky emphasizes that physicians who are neither fatigued nor distressed provide safer patient care and are less likely to injure themselves. He believes that studies measuring physician well-being and relating the findings to patient care and physician safety are important, and that such findings must be taken to heart for practicing physicians as well. Our first featured article is original work entitled Prevalence, Incidence, and Classification of Chronic Fatigue Syndrome in Olmsted County, Minnesota, estimated using the Rochester Epidemiology Project. This article was authored by Dr. Ann Vincent and colleagues from Mayo Clinic in Rochester, Minnesota, and from several other national healthcare institutions. In a retrospective medical record review, the authors ultimately identified 151 patients who truly met criteria for chronic fatigue syndrome among 684 potential cases. They find that the incidence and prevalence of chronic fatigue syndrome is relatively low in Olmsted County, and that careful clinical evaluation to identify whether reported fatigue could be attributed to comorbid conditions such as obstructive sleep apnea, substance abuse, chronic obstructive pulmonary disease, or congestive heart failure is very important. Our second featured article is a review entitled History of the Rochester Epidemiology Project, Half a Century of Medical Records Linkage in a U.S. Population, which was authored by Dr. Walter Rocca and colleagues from Mayo Clinic in Rochester, Minnesota, and from Olmsted Medical Center, also in Rochester, Minnesota. In an update to an article on the Rochester Epidemiology Project that was published in Mayo Clinic Proceedings in 1996, the authors provide a brief history of this comprehensive medical records linkage system that has been in place for nearly half a century for almost all persons residing in Olmsted County, Minnesota. They discuss how the Rochester Epidemiology Project can serve as a model for the development of similar research infrastructures in the United States and worldwide. A video interview with Dr. Rocca can be viewed on the homepage of Mayo Clinic Proceedings. A cluster of articles in this month's issue of Mayo Clinic Proceedings focuses on new insights into the treatment of and outcomes for breast cancer. The original article entitled Comparison of Mastoscopic and Conventional Axillary Lymph Node Dissection in Breast Cancer, Long-Term Results from a Randomized Multicenter Trial, was authored by Dr. Chengyu Luo and colleagues from Fuxing Hospital in Beijing and colleagues from several other Chinese healthcare institutions. The authors randomly assigned over 1,000 consecutive patients with operable breast cancer to either of the two methods of lymph node dissection and followed the patients over a median of 63 months. They find that mastoscopic axillary lymph node dissection has advantages in operative outcomes, complication reduction, function conservation, and cosmetics over conventional axillary lymph node dissection. The original article entitled Effect of Large Tumor Size on Cancer-Specific Mortality in Node-Negative Breast Cancer was authored by Dr. Qida Yu and colleagues from Shanghai Medical College in Shanghai, China. The authors studied over 100,000 patients from the Surveillance, Epidemiology and End Results Registry, also known as SEER. Interestingly, they found that the hazard ratio of breast cancer-specific mortality increased with tumor size up to 50 millimeters in diameter, after which increasing tumor size was associated with a decreasing hazard, with a nadir at 80 millimeters of tumor size. The authors conclude that larger tumor size without lymph node involvement may be a surrogate for biologically indolent disease, providing a clue to better understanding of breast cancer biology. The original article entitled Meningitis with a Negative Cerebrospinal Fluid Gram Stain in Adults, Risk Classification for an Adverse Clinical Outcome was authored by Dr. Nabil Khoury and colleagues from the University of Texas Health Science Center in Houston, Texas. In a retrospective study of 567 adults with meningitis, the authors found that an adverse clinical outcome, defined as a Glasgow Outcome Scale score of 4 or less, could be predicted with a model using 3 clinical variables that are available at presentation, including age less than 60 years, abnormal findings on neurologic examination such as altered mental status, focal neurologic deficits or seizures, and low cerebrospinal fluid glucose levels. The review article entitled Postural Tachycardia Syndrome, a Heterogeneous and Multifactorial Disorder, was authored by Dr. Eduardo Benarroch from Mayo Clinic in Rochester, Minnesota. Based on a comprehensive review of the literature between 1990 and 2012, Dr. Benarroch highlights that the pathophysiologic mechanisms of orthostatic intolerance in postural tachycardia syndrome are multifactorial and that treatment should be individualized because postural tachycardia syndrome is a heterogeneous disorder. Many of the symptoms reported by patients with postural tachycardia syndrome are often not due to orthostatic intolerance. Please remember that authors of 2 of the articles we have discussed, Drs. Colin West and Dr. Walter Rocca, have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. There, you will also find another video interview on an article from our December issue entitled Using Social Media to Improve Continuing Medical Education, a survey of CME course participants. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Vincent Rajkumar, a hematologist from Mayo Clinic in Rochester, Minnesota, who has been an associate editor of and frequent author for Mayo Clinic Proceedings for many years. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the December 2012 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the January 2013 issue of Mayo Clinic Proceedings will contain articles on effect of physical activity on serum PSA levels, why do patients visit their doctors, assessing the most prevalent conditions in a defined U.S. population, and the promise of lean in healthcare. Our January issue will go live on our website on January 2nd, 2013. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.